Hello, everyone. My name is John Mee Jr., and I am a community engagement consultant with NASDAQ, focusing on social determinants of health. If you're watching this video, that means that you either work at a local, state, or tribal health department or at a community-based organization. I want to thank you for utilizing this resource to prioritize community engagement in your ending the HIV epidemic efforts. This section of the toolkit will be discussing the importance of addressing social determinants of health when engaging community in ending the HIV epidemic in Southern jurisdictions. Social determinants of health are conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. This section of the Community Engagement Toolkit will highlight videos from community leaders to provide insight on how social determinants of health should be incorporated into community engagement efforts. Our first guest is Dr. Oni Blackstock. Hi, Oni, how are you?
Hi, John.
I want to first start with, tell us a little bit about your background and how you came to this kind of work. So as you know, NASDAQ was given supplemental funding to provide technical assistance to Southern EHE jurisdictions on community engagement. One of the topics that we provide assistance with is social determinants of health. Why is addressing social determinants of health important when engaging communities affected by and at risk of HIV?
Right. So, John, as you mentioned in the introduction, right, so social determinants are really sort of the conditions in the environment where people are living and going to school and playing and worshiping, and conditions that affect people's health and well-being. And so some of these are healthcare access and the quality of care that people receive. Some of it is around, having access to healthy food, employment and education opportunities. And we know that the social determinants of health really impact people's ability to prevent themselves from getting HIV, as well as if they are living with HIV, their ability to engage in care. So for instance, if someone does not have access to healthy foods, is food insecure, we know that food insecurity is a risk factor for HIV, because people may be more likely to engage in for instance, sexual behaviors, maybe exchange sex, that could put them at higher risk for HIV, similar to having healthcare access, healthcare coverage. Being able to get an HIV test if you're concerned about your HIV status, having access to PrEP, having access to HIV treatment and a regular provider. So we see that really the social determinants of health, really in many ways affect risk, the ability of someone to be able to protect themselves or conversely be at risk for HIV.
And as former Assistant Commissioner of the Bureau of HIV, within the New York City Department of Health and Mental Hygiene, what are some of the strategies that the Bureau of HIV has elicited to address social determinants of health?
Yeah, so just to say that I think, in terms of addressing social determinants of health, that is an area that many public health departments should be invested in. I will say that the ways in which, for instance, that funding happens, that can make it very challenging. And so what happens is, like, public health is often siloed away from, for instance, streams of funding around employment and training opportunities or around housing. So just to say that I think the federal government, and as well as state and local governments, definitely need to do a better job at sort of integrating and sort of mixing the streams of funding so that health and public health isn't happening in a separate space than housing and job creation and things like that. And so just to say, the new federal administration has an opportunity to really help to coordinate, for instance, different executive branch agencies like Department of Labor, Housing and Urban Development, sort of work with those agencies and help to coordinate so that we have a coordinated and streamlined effort in terms of combating HIV in terms of EHE. So I would also say that at the New York City Health Department, some of the work that we did, for instance, included embedding access and navigation to community-based organizations that can address social determinants of health, like in our HIV prevention and treatment model. So, when we work with agencies that receive funding through the health department, ensuring that those agencies are not just linking people to or providing clinical services like prescribing PrEP or HIV treatment, but they're also able to connect patients and clients with social work who may be able to then, connect folks with resources around, access to food or access to housing or things of that nature. We also, at the health department, when I was there, partnered with a national organization, Working Positive, I believe, coalition, around holding a one-day, basically career fair and sort of a multi-event sort of programming that included, different employers coming to talk to potential candidates, where folks could get headshots done. They can get clothing to wear to interviews. So even though we may not have been in the business of creating jobs, if we are able to link people who may be living with HIV or at high risk for HIV to employers who are looking for candidates or employees, to other resources that can help folks to strengthen their skill set. Those are ways that we can really help to address social determinants of health. Yes, and so I think it's really about being creative with what community-based organizations you're partnering with, because there may be a CBO that maybe is focused on job training. There may be a CBO that's focused on let's say housing. And so these may not always be natural partners when we think about HIV, but when we are thinking about how can we improve clients and patients' engagement in care, in treatment and prevention services, these partnerships with organizations that are really on the front line and know how to get folks access to these resources can be incredibly helpful.
As you know, in the South, in the whole United States, but particularly in the South, there is a history of medical mistrust, specifically among the African American community. How can Southern health departments really kind of address the medical mistrust that these communities may have when addressing social determinants of health?
Right. So we know that medical mistrust is a consequence of both historic realities, but also present day realities. So the way that Black people may be just treated in their everyday life, just going about their business and confronting for instance racism, everyday racism. And so what's important for health departments is to understand that history as well as present day reality, and that the mistrust that develops may influence and impact people's engagement with the public health department, with other programs they have, staff that they have. And so what's important is the health departments train their staff in what are the factors that have contributed, both past and present, to mistrust that communities may have, and what are ways to intervene on and to address the mistrust. So for instance, I think we're hearing this come up a lot around COVID-19, but I think around anything, making sure that you're working with trusted messengers in the community who have the ear of community members, are seen as trustworthy, and can also help to deliver some of the messages that the health departments are trying to promote. I think also health departments also have to show why community members should trust them. And so, that includes, developing programming that really engages folks from the community, that really, elicits, their opinions and thoughts about various programming, and where community members are able to play a leadership role in shaping health department's agenda, and do that in a really meaningful way, so that it's not just lip service, and you're just listening to whatever the community members are saying, and then you go and do whatever you want to do. Really having meaningful engagement with different constituents at the table, and who can really meaningfully contribute to the programming that the health department has. So I think those are some ways that mistrust can be addressed. I think also, much of, as I mentioned, is rooted in these larger systems of oppression. So for instance, racism, so really having health departments do some sort of inside work, doing anti-racism longitudinally, preferably anti-racism training for leadership and staff, and figuring out how to make the workplace more equitable, as well as the work that's going on in the communities more equitable.
Definitely. Thank you so much for that insight. Thank you, Dr. Blackstock, for giving your time for this project. It's super important, and talking to us about how we can address the social determinants of health.
Thanks so much for having me, John.